I will be modeling the baroreceptor control of blood pressure using various materials. Here we have a representation of the left side of the body. However, the right side of the body is identical. We have the brain, the medulla oblongata, which is part of the brain. You have a couple of nerves here, your internal and external carotid arteries, your left common carotid artery, your aorta, and your heart. Your heart rate is controlled by how many beats you get per minute, which determines the amount of blood pumped out per minute, which is known as your cardiac output. The stroke volume refers to the amount of blood pumped out per heartbeat. When homeostasis is disturbed, your body responds. Your body recognizes both the increases or decreases in blood pressure and knows it needs to respond in order to return your body to homeostasis. At the base of your carotid artery is your carotid sinus, and inside your aorta you have an aortic sinus. In this area you're going to have your aortic sinus, and here you're going to have your carotid sinus. Both sinuses hold baroreceptors. These baroreceptors respond to the decreases and increases in blood pressure by detecting the stretching of your aorta and your carotid arteries. Your brain knows how many action potentials your body fires per minute. This is known as your sympathetic and parasympathetic tones. Relating to your blood pressure, your action potentials are conducted by your glossopharyngeal and your vagus nerve. If your blood pressure goes up, your baroreceptors are going to feel the stretching in your aorta and your carotid arteries, so your nerves are going to start firing more action potentials per minute. On the contrary, if your blood pressure goes down, the stretching is going to happen less than before, and the number of action potentials your body fires per minute will be less. So an increase in pressure is going to cause more action potentials to fire. A decrease in pressure is going to cause less action potentials to fire. These action potentials fire to your vasomotor and your cardioregulatory centers in your medulla oblongata. You have two cardioregular centers. You have your cardioacceleratory center, which refers to the speeding up of the action of the heart, and you have your cardioinhibitory center, which refers to the restraining of the movements of the heart. When your baroreceptors decide whether your blood pressure is too high or too low, they send a message to your brain through your nerves, and then your brain responds. Your brain decides to stimulate one of your nervous systems. Your parasympathetic and your sympathetic nervous systems both have an effect on your heart rate and your blood vessels. The sympathetic nervous system increases the heart rate and stroke volume, causing the heart to contract harder so you have more volume of blood going out with every beat. On the other hand, the parasympathetic nervous system decreases the heart rate and stroke volume, making the heart work less forcefully so you have a smaller stroke volume, which means less blood going out with every beat. When your body is responding to a decrease in blood pressure, your sympathetic nervous system causes vasoconstriction, which causes the arterioles to get smaller. This increases the total peripheral resistance. Your parasympathetic nervous system causes vasodilation, which causes the arterioles to get bigger and the total peripheral resistance to decrease, which causes a decrease in your blood pressure. And remember, your arterioles are the vessels that help deliver blood to your capillaries. So as a recap, your body has sinuses that hold baroreceptors. These baroreceptors respond to stretching of the aorta and carotid arteries, or rather a lack of stretching, and they decide whether or not you need an increase or decrease in blood pressure. They then send action potentials, or less action potentials, through your glossopharyngeal and your vagus nerve to your medulla oblongata, and then that is able to respond and make your body either decrease or increase your blood pressure, returning your body to homeostasis. This is a rapid response. It happens within minutes or seconds because your body needs to return to homeostasis very quickly.